with aortic teams as well. So great. Thank you, Holly. I do want to thank Dr. Vies for the invitation to speak to you today. And my charge is really to talk about open. Great discussion on the last session. And really one of the issues is the standard of open. That's why it's been difficult to sort of switch, because the results have been pretty good. And that's what I'm going to share with you today. My disclosures, as we all recognize, hybrid is not on the horizon. Endo is not on the horizon. It's here now. We accept the fact that it's less invasive, but you have to have more anatomical suitability. Results of hybrid in general will range between 10 to 12% on mortality. So older review series, 7 to 8% in stroke. Open repair, really, I'm going to thank Dr. Desai for some of these slides. This is the STS registry database, and we're talking about 45,000 cases. Within that, the operative mortality for proximal arch replacement, or what we call the hemiarch, is about 2% operative mortality, in-house mortality 1 to 2%. And then stroke, we're talking about 2%. Now, if you add circulatory arrest to this, it's going to be a little bit higher, a little more complex cases, but still mortality very reasonable, 1 to 2%, and stroke around 3% in this series. Now, accepting this is sort of the standard in my mind. Mortality, as Nimesh said earlier, 1 to 2%, stroke 2 to 3% for this subset of patients. Now, there are total arches that are being done, and we recognize that many of these are done with frozen elephant trunk procedures. This is a contemporary collection of series, and when you look at this, including both emergent and non-emergent type cases, Canadian series talk about mortality of 8%, stroke 7.5%, STS 8% mortality, 12% stroke, and again the STS hybrid around 6% stroke and 6% mortality. Now, I look at this paper because this is the pivotal trial Dr. Caselli and a number of high volume centers published that got acceptance of the Thoraflex in the US. And when you look at this, the mortality is around 3%. And again, high volume centers doing frozen elephant trunk elective procedures, stroke 6%, and paraplegia about 5%. So these are really the numbers that we're starting to think about. And looking at frozen elephant trunk in contemporary series, again, 3 to 10% for stroke, paraplegia 4.5%, and mortality 2 to 15%. The Achilles heel really is stroke, and when you're talking about endovascular, there are a lot of these sessions that talk about this, but don't really talk as much about stroke and stroke prevention, and also durability when you're talking about endovascular. This was the V Symposium last year. We're going to hear this session. Again, mitigating stroke is going to be an issue that needs to be addressed in the future. Intraoperatively, there's so many variables that we think about in trying to prevent stroke. That's why it's really hard to study. So it's not just perfusion. Looking at our series of elective cases over the past 20 years, about 1,600 cases. These are some of those operations. Now, we're talking about all cases elective for us is stroke around 5% and operative mortality about 7%. Now, one of the strengths of open really was is the durability, and as Eric mentioned earlier, we need to think about 10 to 20 years. So these are some of the results at 20 years, very reasonable. So the standard open really is around 5% mortality, less than 6 for stroke, less than 6 for paraplegia, and this is what we need to match when we're talking about total arch replacement from an endovascular standpoint. So what do the experts say? American Heart Guidelines basically say anyone who's unfit for open surgery should be considered for an endovascular approach or a hybrid approach. And the recent European guidelines stated that were presented in Vienna just last month really talked about the same thing, also being done with aortic teams as well. So this is a patient who was too high risk for surgery, could not be taken care of with an endovascular technique. Optimized, went ahead and did her open, big type 1A endo leak. She actually did very well from this operation. You can see the post-op, all the material taken out actually allowed her lung to do better. She was on hospice before, actually she's doing very well now. So what have we learned? Really open arch replacement remains the benchmark currently. Stroke remains a challenge, and endovascular repair is here for selected patients. We need to keep working on trying to reduce stroke for these patients, and we need to have better universally accepted reporting standards for this. I thank you again for your attention.